From KPRC2, this is Houston Newsmakers with Cambrell Marshall.
And good morning and welcome to Houston Newsmakers. I'm excited in more ways than one to introduce my first guest this morning to talk about a groundbreaking new effort to create equitable opportunities for good health in Houston. It's called Fit Houston. And to talk about what it means and who will benefit, Larissa Jacobs is the board president, founder, and executive director. Dr. Stephanie Coulter is the assistant medical director of the Texas Heart Institute and the founding director of the Women's Center for Heart and Vascular Health. Good morning to both of you, and congratulations to you, Ms. Larissa, on getting this point. So for people who don't know, explain to viewers what the concept is and how it came about.
Yes, well, thank you so much for having us on the show. We're super excited. Team Fit Houston was actually part of an effort by Houston 2036 Task Force on Equity. It was really an incubator of sorts, bringing all kinds of leaders from all over Houston, 36 of us to be exact, and just divided us into 6 groups. And we made up these teams and tried to figure out what can we do to really get Houston healthier. There were other topics that we covered, such as education and environment, but our area of concern for Fit Houston was health. And so, we thought about what's the one thing that people could do every single day that could be free to improve their health, stave off chronic disease, and it was really physical activity. Move a little. Do
you find that there was a disparity in the ability for various people? We can all come up with excuses not to be healthy, but within the communities that were around Houston, did you find that there are different areas where there's just not that availability and there's more of an excuse not to do?
Yes, that's a great question because, I spend a lot of time in the community, and a lot of the feedback from residents has been that it's either hard to get to a gym, or they can't afford it, or there's not one close by, or they need ideas for being physically active. So, just a lot of listening sessions in many different communities, and it really does point to one direction, which is we need to exercise.
Dr. Coulter, why is the Texas Heart Institute invested and involved in wanting to be a part of this kind of effort?
Well, when we first heard about this initiative, we'd already been involved in the community, and we'd worked with many of the players in the team, on this team. So the first I heard of it, I was like, we're full on in. So we're in for all the right reasons. I'd like to add COVID to the other problem with why people quit going to the gym. And honestly, some people don't have time. Working moms, there's not time to go to the gym. I remember a cataclysmic event for me in my life was when my children were big enough that I could leave them in the house alone so I could run alone, okay? So you need something that you can encourage people to do that doesn't cost money, that they can do in their own home with their children. So you can walk, you can play, you can run, so I'm for the least time spent. I don't have time really to go to a gym.
Well, it seems logical enough that exercise is a good thing. The statistics make that very clear. For example, Johns Hopkins Medicine lists a number of benefits. Among those, lower blood pressure, helps weight control, helps strengthen muscles, helps lower stress. All of us can use that. And slows development of diabetes. So now the challenge of trying to convince people to do what they need to do to try to get some of those benefits. That's kind of much easier said than done, isn't it?
But humans love to copy one another. So when you have a big group of people participating in something, like we've launched this challenge where we're going to have an app which we encourage people to obtain. And it's one way of comparing yourself to your friend groups, your family members. So there's a lot of opportunities to compete.
So, Larissa, let's talk about the January plans for the kickoff of this and how, Dr. Coulter's saying that it's going to be kind of a group thing.
Yes. Well, we should be active for about 150 minutes every week. And what that could look like is a 30-minute walk every day. It's actually 5 days a week, but we can walk 30 minutes every single day. And so the health campaign that we're running across the city, it's a citywide health campaign. It's called #Walk30. The app is through MoveSpring. We're very excited to work with them, and it's the same app that City of Houston uses for their employees, and so it's been really nice because people are already using it. We want people to download the app. They can go to our website and learn more, but once you do that, you can see how much you've been walking, how many steps you've gotten, and I think also distance.
You've put a lot of effort into the website that talks about some of the issues. Evidence-based information is already there as well. I found it interesting. A couple of graphics on your website illustrate some of the Harris County problems. For example, the colors that are darker colors, reds, that's the diabetes, for example. Adults with diabetes, darker colors show the communities, the percentage where it's higher. And also there's another graphic that illustrates the area where there's low activity. And there's no real shock that the areas where there's low activity corresponds with the areas where there's higher diabetes. And so when you see that out there, it's like a win-win. It kind of helps you, doesn't it, Dr. Coulter, to get that conversation started and say, look, this is evidence that if you just do more, you can be more healthy.
Well, I use it every day because I see patients every day. And you can't decide in the morning if you can lose 20 pounds that day because it's not possible. But every single day, you can walk. You can walk 30 minutes. We're encouraging everyone to walk because if you walk, you're going to feel better. Your blood pressure is going to be better. Your glucose numbers are going to be better. You're going to use less insulin. Your pancreas is going to last longer in life. So every day that you walk, you're prolonging the life of your pancreas.
So now you have this challenge, Fit Houston, long-term goal for you and the organization at this point.
We would like to see the city of Houston and Harris County and all areas, all people everywhere be physically active and vibrant. We want people to feel better. We want people to know that movement really is what you need. It's the perfect ingredient for a good life and good quality of life. So move every day. You know, somebody recently said, I think I saw this on the news, that there was somebody famous saying, you know, if I don't move, I freeze. As I've gotten older, if I don't move, I freeze. So let's unfreeze everybody and get moving.
So what's the best way for people to get involved, to take part in this?
Yes, join the challenge. It's for January. #Walk30. Go to our website, fithouston.org. You can find out more about how to download the app there. We do have a code available. It's on the website. So, you know, join us. Walk, post a selfie, please. Show us your selfie and, you know, hashtag us. Follow us on Instagram at @FitHouston1.
Well, you know, I'm going to put all this information on the Newsmakers page at
That's very helpful.
clicktohouston.com.
Thank you.
We'll
We
do
need
that.
all the help we can
I'm taking
get.
great advice from you. I always listen to my doctor. And you're my doctor now for
yeah.
this morning. Dr. Coulter, Larissa, thank you so much. Good luck in 2023.
Merry Christmas.
Thank you very much.
Thank you.
Yes, Merry Christmas to all of you as well.